It's a simple test that can help people know whether they're at risk of serious heart problems. Doug Johnson has more on how one Mid-South man found out about the test and his problem by trying to find out about the next day's weather forecast.
Billy Lewis is a busy 78-year-old. He works every day in the furniture business, but still takes time for a daily walk in Marquette Park. But at one point, he wasn't feeling good, even with the walks.
A couple of years back, my feet got to swelling, ankles were swelling, legs swelling. I couldn't burp, bloated, red in the face.
His blood glucose was high too. He went to his regular doctor, but didn't find an answer.
And I told my wife, I said, you know, something's wrong. I can just sense something's not right.
Lewis decided he'd try something different after seeing a local TV weatherman talking about his own heart problems on the news. After feeling tightness in his chest, the weatherman got a calcium screening test at Stern Cardiovascular Foundation. Doctors found the arteries leading to his heart were blocked. Lewis decided to go to Stern Cardiovascular for a similar test, but thinks he came close to not getting there.
I was at this exact park. I got out of my truck, walked right here to this curve, went back to the truck, and I was due the next day to go in to get the screening done.
And he had a calcium score, and a calcium score looks to see if you have any calcified plaque in your coronary arteries, and a normal score is 0. His was over 2,800.
That's out to ceiling. So they put me right on in.
Dr. Gubin says Lewis needed a cardiac bypass to transplant open arteries to replace the blocked vessels leading to Lewis's heart.
Then all the problems that I was having, they disappeared.
Lewis lost 37 pounds of fluid during his recovery and is no longer short of breath.
And they kind of called me the miracle because I didn't have a heart attack, I didn't have a chest pain, arm pain. They said it was no damage to the heart. It was just absolutely a case of the good Lord being with me in pure luck.
Lewis is sharing that luck. 2 of his friends have already gotten treatment after going through vascular screenings at Stern that he recommended they have.
We do this vascular screening like the 3rd Thursday of every month, and we do it in the evening, so patients don't have to, miss work. And they come in, and we do a little screening, EKG, just to make sure the rhythm's normal, check their blood pressure, check their cholesterol.
Call Stern Cardiovascular at 901-271-4192 for additional information. Now, there's one thing to keep in mind. Insurance usually won't pay for these screening tests, but at about $250 for this entire battery of screenings, it can be money very well spent. For Smart Medicine, I'm Doug Johnson.